Joe 200, how are you? Hopefully you had a relaxing President's Day weekend, and today is the 19th, and so we're going to be launching right in to our assignments, okay? What we're going to be doing now is we're going to be going into our weekly assignments, and we are going to come down here and scroll down to February 18th, okay, which is diabetic heart disease. It piggybacks on diabetes. We want you to link diabetes, heart disease, and then ultimately Alzheimer's disease. That's the goal of this section of the class. And I'll reiterate that when I kind of review what you need to do for doing the second critical thinking assignment. Okay, alrighty, so we go launch right in here, the diabetic heart disease, okay? You're not going to see my video here because I'm going to post it in a second. And I want you to understand what atherosclerosis is. Okay, you watch that video, and I want you to get in here and sift through this and understand the link between diabetes and atherosclerosis. And in a bigger overall view of this disease, it's called metabolic syndrome. And there's multiple aspects of the metabolism. So we see right here, we call it metabolic syndrome, that puts you at risk for heart disease, heart failure, stroke, kidney disease. And it is a domino effect of diabetes that then causes atherosclerosis and then causes these problems, okay? And we're going to see later on, okay, when you do your report, which is CT2 coming up right here, that there is a direct link between Alzheimer's disease and diabetes in terms of risk, okay? 80% of all Alzheimer's patients have diabetes. So that's telling you something's going on, and it's what diabetes does to the vasculature, okay? And you get a real good review by watching this video right here. Basically what happens is, and I'll tell you real quickly, is a diabetic, okay, uncontrolled diabetes, and it's more of an issue for type 2 diabetes. This is the adult onset. This has a lot to do with genetic risk coupled with long-term bad choices in terms of environment. And when I say environment, I'm talking about exercise and diet. And so what happens is your insulin receptors become resistant to the insulin that gets released when you have food, okay? And in particular, it's the sugar that comes in with food. It's the glucose, causes the insulin to be released, and it tells the body, here comes a loaded crisp of insulin. They just had a meal, package it away and get it out of the blood. When you're resistant, the insulin doesn't work, and so the glucose stays really, really high. And then this causes the sugar to fix itself to proteins, which become toxic, okay? These toxic proteins then will trigger this atherogenic response, which is the disease of your vasculature that causes a cutting off of blood flow that will cause heart failure, okay? Heart disease, that means that the heart's slowly dying off. My dad died of congestive heart failure, which is heart disease. My wife's mom, Julia, I'm going to talk about her in a second. My wife Julia's mom, Lorraine, my mother-in-law, died of heart failure. She actually had an aneurysm, which is a blown blood vessel, and she had many clogged arteries. Stroke, kidney disease, these are all because of what the diabetes has done to the vasculature, okay? It's a metabolic issue. It's oftentimes associated with morbid obesity, especially tummy fat. That is the biggest risk factor, okay? And you will learn all this by going into this link right here. I'm going to click on it right now. It's probably going to take a little while to load, so I'm just going to go right here. We have all the readings that you see listed in this assignment. Boom, 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 boom. We've put out the essentials as PDF files just in case you have issues, okay? So you can see that it's loaded up over here right now. You go into it and you look at ischemic heart disease, okay? And it gives a full-on description of what's going on here, okay? Ischemia means that the blood vessel has occluded, so it's only this big around, and then what happens is I'll stick my iPhone in there or something like that, and boom, it gets clogged. No longer have oxygen and glucose, and all the tissue on the other side dies off from ischemia, which is lack of oxygen and glucose. Okay. It always affects the big arteries. So this is what has the most blood flow, your heart and your brain. So your coronary arteries will get occluded, so you get coronary heart disease. Okay. Same thing happens in your carotids that will affect your brain. So I just want you to kind of review through all this. Okay. You go down here and you show some curiosity, and you find out all the unique features. Again, it's this hypertext. You can look at screening and prevention if you wish. You can look at causes, okay? We can look at plaque buildup right here. It kind of reviews what I was talking about, so you go into there. It talks a little bit about the plaque, the hardening of the arteries, the narrowing that comes with this, okay? You can look at the molecular changes, okay? And this is a lot about what I was talking about as well. So I just want you to review this. Risk factors, and we see right in here that high blood pressure, okay, is a big risk factor, and we also know that unhealthy lifestyle habits, things like obesity, are a big risk factor. So you can go through all this and review this. Okay, and this is of course what's going to be looked at when you deal with your quiz down here. You have to watch this video. Okay, it relates directly back to the second critical thinking assignment that's coming up pretty soon, March 4th. And again, when you go through this, all you need to do is just kind of answer the questions. Okay, so we're going to get down here. So here's CT 2. There's some very, very clear questions. What is diabetes? Type 1 versus type 2. Okay, juvenile onset. This is an autoimmune disease where the person's own immune system attacks the pancreas, so it no longer produces insulin. So this is completely insulin dependent, meaning you have to do insulin injections. Type 2 diabetes. This is adult onset. It has to deal with the insulin receptors are actually normal initially. They become resistant over time, and over time they can also use insulin, but they use a lot of other drugs. Okay, how does diabetes cause atherosclerosis? You can just do quick searches. You can listen to what I talked about. It all has to do with these toxic sugar-coated molecules triggering the atherogenic response, along with creating a big increase in oxidation. You're just going to have to search for these keywords and you'll find out what's going on. Okay. It asks you how it's linked. You asks you how you're going to diagnose. You asks you how it's treated. You just do searches. I can do a quick one right here, and I would say diagnosis of diabetes. Okay. And so you just go to Mayo Clinic, or you can go to the American Diabetes Association. So I'm going to look at diagnosis and treatment doom. It tells me exactly what I wanted to see. Okay, type 1, okay, and type 2 diabetes. So we're going to look at the hemoglobin A1 test. This looks at how many sugar-coated molecules. These are the cutoffs. Okay, you don't want to be over 6.5%. Okay, this right here shows you you're at risk. Okay, we can do blood sugar test. We look at the fasting blood glucose or a glucose tolerance test. Okay, you want to be less than 100 milligrams per deciliter. Okay, that's 1/10 of a liter. And you down here, and then you look at a glucose tolerance test where we give you a known level of glucose, and we look at what it is. Again, if you're over 200, it's not good. Okay, all right. So that's what that's all about. And we get down here, and you see treatment. Okay, and there's lots and lots of different types of treatments that you have right here. Okay, so that's how you do that. Okay, same thing with Alzheimer's. So you would just go back and you would say diagnosis of Alzheimer's, and then and treatment maybe. You can get it all in one bag. Okay, there it is. Okay, so dementia treatment options. Okay, here we go. Diagnosis. Go to the Mayo Clinic. It's one of the most spectacular places there is. You'll see very clearly that the diagnosis of Alzheimer's, we don't have a blood test. Okay, all we have is a neurological exam. Okay, you will do a blood test to rule out other problems. Okay, you can do imaging. Okay, on and on. These are usually not done, and then you do a behavioral test called a mini mental status exam. Alrighty, the drugs that we have are not very numerous. We have 2 classes right here. Okay, alrighty. So it's pretty straightforward stuff, guys, and I know you guys are going to kill this. Okay, so now we're going to go back here to not that. We're going to go back to the weekly assignments. Okay, and again, follow the rubric. Go down there, and you can see what we're looking for. Okay, so we go back to the weekly assignments. I'm kind of hoarse because it's kind of per the weekly assignment. We come down in here, and a big part of the weekly assignment, of course, is your discussion right in here. And we're going to be talking about care systems. And my wife, Julie, and I just dealt with a major aspect of care systems. And you guys can come up with a business model and a solution because it's a big deal. So like I said, my mother-in-law died a couple of months ago. So we went back and held a large memorial in New Orleans over the weekend. And a big part of it was my father-in-law. He's my wife's stepfather. He has major disability. He was totally dependent on my mother-in-law, and now he's at odds. So we went back there and completely cleaned his house for him, got rid of all of her clothes. We got care systems in place. However, he is moving to Florida to be close to his sister because he can no longer care for himself. And there's so much that goes into this. So we're setting up his house and getting it staged so he can sell it, so he can move to Florida. So this is all comes under your responsibility of care systems. And I'm just dead tired because we're flying back from New Orleans and we get out to the runway, and all of a sudden we find out that the pilot gets on the speaker and says, we have a problem with our APU. Like we know what an APU is. I look it up in Google. It's an auxiliary power unit. And he says it seems to be working, but the sensor is going off. So if you have patience, we're going to go back to the gate. We'll fill out some paperwork, and we'll be leaving in a couple minutes. An hour goes by. 2 hours go by. And then and we're sitting in this airplane, no air conditioning, no water, and United Airlines, okay, and then suddenly they couldn't start the engine and tell us, okay, we're all going to have to deplane, and then they get on in the system and say, wait, I think we can start it, so you can deplane, but you're on your own. Thank you. Okay, so then it took 3 hours. Of course, we missed all our connecting flights, and we go into Houston because we were connecting out of Houston to go back to Santa Ana Airport. And so the solution is we're going to have to spend the night, which we did last night in Houston, and fly out the first thing this morning. I was supposed to get back last night. And thank you, United. You put us up in the Red Lion Inn, and I've traveled the world, and I've been all throughout many different parts. And this particular hotel was one of the worst freaking hotels I've ever seen in my life. Torn up furniture, nasty sheets, chips in the ceramic tiles that are in the bathroom. Oh, it was horrific. Anyways, so I think we should wage a campaign against United Airlines. I know my lawyer wife Julia will, so it's awesome. Okay, guys. So that's in a nutshell what you need to do for this week. Again, just think of the linkage between diabetes to vascular disease, which is atherosclerosis, and how when the vasculature gets compromised, how that leads to a dying off of the heart, which is heart disease, and other diseases, okay? Kidney disease, which will affect your heart, stroke, which of course is the brain, and then if you compromise the brain, then you're going to get Alzheimer's, okay? All right, guys, so hopefully I'll get my voice back, and hopefully I'm going to go to sleep here real soon. Take care, and we'll see you guys next week.